With respiratory viruses on the rise, even more local hospitals brought back mask mandates, and that includes all 11 New York City-run hospitals. The city health commissioner tells us emergency rooms are busy with coronavirus, flu, and RSV cases. Eyewitness News reporter 𝗙𝗘𝗪 is at Elmhurst Hospital in Queens, where the mandate is now in effect. Crystal.
Well, Joe, Elmhurst Hospital here is in one of the most diverse communities here in New York City, and it saw some of its darkest days during the COVID-19 pandemic. Now, as you mentioned, one of 11 New York City public hospitals reinstating its mask mandate.
You have to be careful. It's not only COVID, there's so many things going on out there.
It's a battle against COVID, the flu, and RSV this season. And outside Elmhurst Hospital in Queens, we found folks wearing their body armor.
They told us when we came in the huddle this morning. They said that we must wear masks. We got to work together, right?
Doctors are seeing an uptick in respiratory illnesses, prompting an indoor mask requirements at all New York City public hospitals, including Elmhurst. New York City Health Commissioner says it's the right move as we come out the holiday season.
What we don't want is staffing shortages, right? When we saw the Omicron wave in 2022, the biggest issues were not only people getting sick, but that we had a lot of frontline health workers out with COVID.
The mask requirement also applies to all health clinics and nursing homes that New York City Health and Hospitals operate.
Every week we are getting more overnight calls about the kids with fever, cough.
Dr. 𝗙𝗪𝗪 𝗬𝗢𝗪 was on the front lines of the COVID-19 response in diverse Washington Heights, where he says there's a high population of patients with asthma, high blood pressure, and diabetes, conditions that can make it easier to get sick with either COVID, the flu, or RSV. This is the first season where there's a vaccine for all three respiratory viruses, still a roadblock in the fight against this triple threat.
There's a lot of resistance, especially in minority communities, about getting the influenza vaccine.
Dr. 𝗙𝗪𝗪 𝗬𝗢𝗪 says the mask requirement in patient areas should apply to all health facilities. Health advocates say the rise in respiratory illnesses isn't so vastly different from years past, but they are much more prepared thanks to lessons learned during the pandemic.
My message to New Yorkers is that it's not inevitable that you're just going to fall victim to this. There are tools and there are strategies we can take to keep ourselves and our families safe.
And those strategies, of course, include getting vaccinated, social distancing, and, of course, wearing a mask. Now, health officials say that even though emergency rooms have been busy dealing with these respiratory illnesses, that people are being hospitalized for a shorter amount of time than in previous years.